How you doing?
How you doing, Khaled?
How are you?
My phone.
Was lots to talk about on a Friday, and
Yeah,
I,
Fridays tend to be busy days. It's a good day to have your weekly hit.
I kind of wish I had it 5 minutes after the presser, but but let me ask you about what's going to happen today. What do you think the lockdown will look like today?
Well, the rumors are you're going to see retail shut down, sort of similar to what we were experiencing back at the beginning of the pandemic, and it would be for Toronto and Peel. So it will affect Mississauga, Brampton, Caledon, and the city of Toronto.
Do you think it'll be a full shutdown or a partial shutdown or kind of back to curbside pickup?
Well, we've never had a full shutdown. I think it's just going to be back to the curbside pickup they had. And people say, are we going to have a lockdown? And I say, lockdown was never something that we experienced in Brampton because the majority of our workforce are in essential workplaces and industrial settings. And so even in March when they had the shutdown, the majority of our workforce was still working, given the roles that they play that are critical to the supply chain of the country. So that's what we're hearing, is that it's going to be gyms and restaurants and retail shut down. From my perspective, this is sort of tinkering around the edges. We really need to focus on where the transmissions are coming from, and that's in industrial settings. And right now, they're not being shut down.
If the lockdown doesn't go, sorry for using the word lockdown, but the rollback does not go far enough, do you see the Chief Medical Officer, Dr. Lowe, putting in more restrictions in Peel?
So I don't see enhanced restrictions coming from Peel. What I would say is, my worry is that it's focused on the wrong areas. We spend all this time talking about restaurants and gyms, and I have zero transmissions from restaurants and gyms. I've had 116 workplace outbreaks. We have major challenges in industrial settings, and rather than tinkering around the edges about restaurants, how about give us help when it comes to an isolation center for essential workers? We've had truck drivers consistently contracting COVID-19 in the States. How about for the outbreaks we've had in places like Maple Lodge Farms or Amazon that are considered essential workers? How about that support? How about more testing? How about sick benefits for people who don't have to feel pressure to go into work when they're working in a factory, living paycheck to paycheck, and they don't want to miss putting food on the table or being able to make their rent payment? That's the type of conversations we need to have.
Now, you bring up a good point. Was Brampton set up to fail this COVID-19 pandemic prior to the pandemic, based on the healthcare crisis?
Well, I'm not sure I agree with the premise of the question. I think Brampton was set up to be relied on to a greater degree. A lot of cities have very small essential workforce. We've got 20,000 workers just in food processing and transportation logistics alone.
True.
That doesn't even get into healthcare, EMS, or the medical field. And so I do think there's been a heavy national reliance on Brampton. I think that we're more vulnerable because of the amount of precarious employment we have. I think we're more vulnerable because we don't have the same healthcare capacity. I think there were some inherent vulnerabilities, and I think there's been an over reliance of the country on Brampton to manage the supply chains.
Dr. Lowe did mention this week that a broad economic shutdown would not actually fully help Brampton because of the workplace outbreaks and everything. If this comes about, does it really help Brampton?
It's just tinkering around the edges.
Yeah.
And what I would say, the test you should be saying is, how does this help? What restrictions help when it comes to our busiest settings? Our busiest settings are industrial. And so if there are restrictions that say we're going to shut down all factories for 2 weeks, I'm sure numbers would drop, but then the rest of the country wouldn't have food in their grocery stores, and so they're not going to do that. So those are the type of questions you're going to have. And, I have to say, one thing I struggle with a little bit is you look at the small business in our downtown. And an example that I gave on my Facebook Live event earlier this week was Restyle. There's a lovely family that runs that store, and when my wife goes in there might be 4 or 5 people at a time that are in there. You go into a Walmart or a Costco and there's 1,000 people. Yet we're going to shut down the small businesses like that one, but leave the big box stores open. I just think we need to be more surgical, and I'm imploring government to actually look at where the transmission is happening.
Now, were you consulted on the plan that is about to be announced at 3:30 from the province?
They've asked for my feedback, and I have given my feedback.
And what was the feedback that you just gave me?
Mm-hmm.
Yeah, okay. So this week, ICES came back with a report that said an area in Brampton had a 19% positivity rate. What are your thoughts on this?
That area also has one of the highest percentages of essential workers. So I think it's no surprise. Where there's more factory workers, more essential workers, you're going to have a higher percentage. Why? They're at a greater risk. If you did a sampling of healthcare workers, they also have a higher positivity rate. Why? Because they take on a greater risk. It's as simple as that.
The projections from the province, 6,000 by mid-December. If this does happen, how catastrophic will it be for Brampton, and what has to be done in Brampton if this does happen?
So right now we're already beyond our healthcare capacity. We were in code gridlock before the pandemic started. So if we really wanted to prepare for those numbers, you'd add additional capacity, you'd add beds, you'd add ICU capacity. It's something that would position us well to handle additional healthcare pressures.
Last weekend, there was Diwali. How many tickets did you hand out? And is there any update on the big Diwali party that everybody's talking about?
So let me say, first of all, there's 100 places of worship, and we had an incident at one of them. And that Gurdwara was fined. A few people that wouldn't leave were also fined. I think the number was 3 people wouldn't leave when they were asked to. But inside the Gurdwara, there was only 10 people. Outside the Gurdwara, there were several hundred lined up to get into for Bondi Chor Divas. But they managed their inside capacity quite well, but they did not have an adequate plan for how to handle the walk-up numbers. And they even brought in paid duty officers to handle the number of people, but it was just beyond what they could control, and the parking lot was ram-jammed, and that's not something that is acceptable during a pandemic.
What would you say right now to a small business that's listening in right now to you about what's going to happen and what they should expect?
I don't think today's going to be a good day for them, and that I'm going to continue to fight tooth and nail for them, because I think there needs to be some leveling of the playing field for small businesses. I don't think these big box international companies should be given a free pass. It creates a disadvantage for our small businesses, these small ma and pa shops that people have poured their heart and souls into these small businesses, and they're not where the transmission is coming from. And so I would say brace yourself for some bad news today. It's going to be a rough 28 days, but I'm going to fight on every call that I'm invited on that the government needs to focus on where the transmission is coming from.
Well, Mayor Brown, that's all the questions I have this week. So thank you very much. And I guess we'll all be watching at 3:30.
Okay, thank you so much.
Okay.